I look forward to speaking with you as many as possible. Just to remind you of some of our ground rules for the Hangout, when Nick or myself call upon you, go ahead and tell us your name, tell us where you are in the world, and go ahead and ask your question or make the comment that's on your mind. And I'll do my best to give you a reasonable reply. No guarantees, but I'll do what I can to answer your question as best I can. And then feel free to ask a follow-up or make a follow-on comment. That would be great. And since we do expect at least 35 or so individuals to want to get on this Hangout in this hour, I would ask you then to drop out of the Hangout after you've asked your follow-on question or made your comment. And Nick and I will do our best to call out you to be live in the Hangout in the order in which you have entered. So with that said, let's go to Jornal. I hope I'm pronouncing your name correctly. Go right ahead, Jornal. I'm sorry, I can't hear you. Is it possible your microphone is not set? Okay, I think what I'll do is we'll go back to you, give you a chance to try to troubleshoot your microphone. Angelica was the next person in. Are you there, Angelica?
Just dropped out.
Okay, looks like Angelica just dropped. There's someone named Doctor. So, Doctor, please unmute yourself and go right ahead.
Hello.
Go right ahead. I can't quite hear you.
Yes, my name is Dr. Ayub. I'm from Kenya.
Yes, thank you. Great to have you here.
Thank you.
Do you have a question for me?
No, I don't have a question.
Oh, you're just joining, just hanging out. Okay.
Yes.
So, what brings you to medical neuroscience?
My dream is to become a researcher.
Uh-huh. Are you presently in medical school, or are you preparing for medical school?
I'm preparing for medical school.
Good. Well, I hope you enjoy our conversations in this Hangout. I may come back to you to see if you do have a question to ask, but at this point, let's go back to Jornal, and hopefully you have a microphone sorted out. Are you ready to go, Jornal?
Type his question and I'll get to it.
Okay. So Jornal is typing a question, which is totally fine. We have a little chat window. Hopefully you all see that as well on the right-hand side of your screen. But let's go to Steve while we wait a question from Jornal. Steve, please unmute yourself and then join us right in.
Yeah, hi there. I'm Steve. I'm in Tunbridge Wells in England. And
Yes.
My question relates to addiction and the nucleus accumbens and the things we've been covering in the last week of medical neuroscience.
Okay.
So with the latest research in neuroscience, do you think that's changing the way people treat addiction? And also the things I'm involved in, like weight loss and obesity, is there research or anything you could point me towards how people's addiction to food is impacting their ability to stop eating unhealthy foods and sugary snacks and things like that, and how the brain is addicting them to foods and how they could eat healthier foods?
Steve, I'm sorry, we're having a little bit of audio problem. I don't know if that's on your end or my end. Just hold on just a second. Nick, are you hearing like a lot of...
So you want to try mine?
I'm going to take these things off. Maybe that's the problem. And go back to my external speakers. So, Steve, your question pertained to addiction relative to foods?
Yeah, so is there evidence about the nucleus accumbens and the ventral tegmentum area in relation to food addiction and people being addicted to sugars and so forth, and the research pointing in that area.
Yes, so what we know generally is that the dopamine system that affects the ventral part of the striatum, the nucleus accumbens in particular, is seemingly what is mediating addictions of all sorts. It's not just addictions to, let's say, opiates or other kinds of addictive drugs that can modify that chemistry, but also addictions to behaviors, to ingested foods and drinks. All of that has the capacity to shape the activity of that so-called mesolimbic dopaminergic pathway and gain access to the brain's intrinsic reward circuitry. So the upshot is that we think addiction to certain food substances, such as refined carbohydrates or even fatty type foods, that those can access the same reward circuitry and become addictive in the way that a drug can. Now, the potency of that addiction is likely to be less for most people, but perhaps for some people, it could be a very potent addicting substance. And that's where the field really needs to understand what the differences are that might make some individuals more susceptible to certain kinds of addictions than others. But essentially, the brain's reward circuitry can serve any kind of experience that has reward value. And so experiences like risk-taking, like food, like sex, these things all have access to that same circuitry. So I think, you know, as we think about pharmacological interventions for addiction, cognitive behavioral, even physical interventions for addiction, I think we need to understand how do those interventions have an impact on that circuitry. So one of the key areas of integration is that ventral tegmental area in the medial midbrain, where inputs are being integrated and ultimately the output is causing the release of dopamine in the ventral striatum. Okay, good. Thanks for your question. Let's go to Deborah.
I think
Okay, Deborah, can you unmute yourself and then go right ahead? I'm afraid you are muted currently. Okay, try again.
Is that better now?
Yes, thank you. I can hear you beautifully.
Oh, okay, thank you. I had a question about, again, being a therapist and a clinician, knowing more about the pain and temperature pathways, possibly even the spinocerebellar, where we have our sense of our body schema, body map, and the visceral pathway as it would relate to pain when we talk about the collaterals or whatever that may be in the different pathways regarding a sense of trauma or emotional difficulties that people struggle with. If you could speak a little bit to that.
Sure. Well, the pain pathways enter the dorsal horn of the spinal cord, and then for the facial region, the spinal trigeminal nucleus. And what we're learning just in recent years, in fact, some of this is not yet in medical neuroscience, but will be in the new year when I start going through some major changes. There is a remarkable amount of integration of incoming afferent signal right at the very first gray matter station. And for the postcranial body, that will be the dorsal horn of the spinal cord. So there's opportunity for incoming pain signals to begin to interact with other somatic sensory channels, including our sense of touch and our sense of proprioception. And I think that's really quite interesting because there's central integration very likely at each subsequent gray matter relay. The fact that it exists at the very first relay in the dorsal horn, I think raises some interesting possibilities, such as why touch can have a different kind of valence for someone who's experiencing pain, whether it be acute or chronic pain. But it also suggests that maybe there are other physical means by which we can interact with those incoming pain signals and find new and innovative ways to exploit an old idea, the gate theory of pain. So the gate theory predicts that there are interactions between mechanosensory information and pain and temperature information. And the classical gate theory model proposes that those interactions occur in the dorsal horn. Now, the details of the original proposed gate theory probably are not correct, but what we're learning is that there are indeed interactions, and interactions at every level. So I think it suggests that there are interesting ways by which the experiences and movements of the body, including those non-painful experiences, might be utilized as a way of addressing pain. Now, that's a very bottom-up approach. Of course, the other important perspective in pain is top-down modulation. In fact, pain really should be distinguished from nociception. So nociception we can think of as the transduction of the stimuli that are provoking pain. But nociception really isn't pain in and of itself. Pain is what our brains create. It's what happens up here. So again, there's multiple means by which we can perhaps engage in a clinically productive manner that central circuitry at the level of the cerebral cortex to help individuals address their pain. So it's an exciting time to be in the field that you're in, Deborah, and to be concerned with the details of how our somatic sensory signals are processed. And I'm optimistic for the future. I think there's certainly more pharmacological and other kinds of technology-assisted interventions that are possible, but I'm even more excited about what we can do just as we learn more about the natural organization of the nervous system to address pain. Okay, great. Who should we go to next, Nick?
Jormel or Jose, the one that was having problems with his mic.
Okay, so Jose, are you there?
I got his question. Okay, his name is Jose.
Okay.
His question is, which is the most primitive part of the brain? I think it is brainstem, doesn't it?
Okay, so Jose's question is about what is the most primitive part of the brain. Your suspicion is correct. The brainstem is the most conserved part of the human brain. There are other parts that are probably just as primitive. For example, the medial part of the cerebellum, what we've called the spinal cerebellum, and even the inferior lateral division called the vestibulocerebellum. Those are probably as primitive as the brainstem itself, but we imagine from an evolutionary perspective the brainstem is really the most conserved part of the brain, and we can think of that as really a extension of the whole caudal part of the nervous system, including the spinal cord. So if we look at the most primitive vertebrates with nervous systems, then we see an extremely similar brainstem to what even we have today. What chiefly distinguishes our brainstem from these more primitive brainstems are the circuits that relate to the cerebellum. So we have an enormously expanded neocerebellum or lateral cerebrocerebellum, and with it comes an abundance of circuitry in the pons and even in the medulla oblongata that serves that cerebellum. But all those cranial nerves that hopefully you learned about in the first few weeks of medical neuroscience, those are present in fishes, in amphibians, in reptiles, and they're organized in a very similar fashion to what hopefully you learned for the human brain as well. So we retain those features, but we've added to them some of that specialized circuitry that I was alluding to. Of course, another component of our brainstem and that of other primates that's particularly well developed is the circuitry that is concerned with facial expressions, particularly those that convey emotion. So humans have a very well developed facial motor nucleus and an even better set of reticular formation connections that are integrating signals that are coming down from the brain that ultimately lead to the expression of emotion in the face. Obviously, some animals like fishes and other kinds of mammals don't express so much in their face, but certainly primates do, and humans most of all. So just a few comments in reference to your question. Okay, so thank you, Jose. Who should we go next to, Nick?
Mohammed.
Okay, Mohammed, please unmute yourself and go right ahead.
He's not Paloma, and then Yasser, and then Paloma.
Okay, well, let's go to Yasser then. Yasser, you also are presently muted, so please unmute your microphone. Well, perhaps some of these individuals just join the Hangout but don't really want to be on camera or don't want to speak. So let's try somebody else. Let's go to Aaron. Are you there, Aaron? Okay. How about Dan? Are you there, Dan? Well, at the moment, everyone who has joined the Hangout is muted and is not responding to my invitation to speak. So I'm going to take that as a sign that you folks who have joined us, you're here in the Hangout, but for whatever reason you don't want to ask a question on air. What I would suggest that you do is perhaps step out of the Hangout and see if somebody else does want to join us and ask a question. So why don't we give that a try?
In the meantime, I got some questions from the forum.
Okay, so Nick is going to ask a couple of questions. Nick, do you want to unmute yourself so everyone can hear you? I'm going to turn down our speakers while you ask your question.
All right, this is from Matthew Jacob Smith. What are the neuroscientific differences between humans and other intelligent organisms, aquatic mammals, primates, etc.? And is there evidence that we have some neurological function that separates us from cognitively from all other life forms? What evidence is there for other organisms having true introspection and conscientious or consciousness?
Okay, thanks so much for that question. Nick, you're muted. So I'm going to reach over and grab my human brain model as a way to just help my response be hopefully a little bit more relatable to you. So one of the differences between the human brain and most other brains on the planet is this massive development of the cerebral cortex. Now, if you were to compare this brain to other great apes, such as orangutans and gorillas and chimpanzees, you would find a very similar brain. It would be smaller relative to body size, and there wouldn't be quite as much of this front part of the brain that we call the prefrontal cortex. And there's one particular division here that has gotten a lot of attention by evolutionary anthropologists. It's called Brodmann's Area 10. It's basically the front part of the prefrontal cortex, what we call the frontal pole of the hemisphere. And that seems to be one part of the brain that is especially well developed in humans compared to other great apes. There are other parts, particularly buried deep in the insular cortex. If you remember, the insular cortex is that part of the cerebral mantle that's buried in the depths of the Sylvian fissure. Here in this model, there's a little bit of the insular cortex shown here on the top of this brainstem piece. This is also particularly well developed in the human brain, especially the anterior part of the insular cortex. So there may be some sense in which there are elements of circuitry in those parts of the brain that are, if not unique to the human, at least well developed in the human. And one of the notions about why that might be is that these are parts of the brain that are involved in social cognition. And certainly we are not the only socially complex species on the planet, but we do have a complexity in our social repertoire that arguably is uniquely human. And some would pose that this anterior cingulate region and this Brodmann's area 10 are particularly relevant for mediating those social capacities. Now, that's not to say that other primates and certainly other mammals don't have a kind of conscious experience or conscious awareness. I'm inclined to think that many mammals actually do have some capacity for introspection. I don't know where that capacity has its limits. I would imagine, for example, that cognition for an animal such as a dog is different for cognition for you and for me. But I do believe that we share many of the fundamental capacities because we share some of the fundamental circuitries in our brains. Now, it is possible that that circuitry is simply used in a fundamentally different way in humans compared to dogs. But I'm inclined to think that dogs have some form of the conscious experience that we do, presumably without so much capacity for introspection, and in particular with a more limited capacity for future projection. One of the functions that we associate with this prefrontal cortex is planning for the future. And the elaboration of this part of the human brain suggests that we excel in our capacity to plan for the future relative to most other species on the planet that have a more rudimentary prefrontal network. So those are just some of my thoughts. I suspect many of you have even more informed thoughts than I do on some of those topics. There was a Let's Discuss forum, or for some of you just getting started, there will be in future weeks addressing this very issue on what makes us human. So I'll be very keen to follow what you discover as you pursue that question. Okay, let's go to I believe it's Artem. Are you there? Looks like Artem's muted. Okay, unmuted now. Hi, how are you?
Hi, thank you very much for this nice opportunity. We in our Yerevan Medical University really enjoy your presentations and this course. And I have also a question about autism spectrum disorders.
Mm-hmm.
And in one of your lectures, you mentioned mirror neurons.
Yes.
Mirror neurons.
Yes.
And so that one explanation of possible contribution to pathogenesis of this very complex disorder could be this impairment in this mirror neuron system. But then I have read some articles that this is now too much criticized. I just wonder, what is your opinion? What is now the really leading theory of pathogenesis of this disorder? Thank you.
You're welcome. Thank you. And Artem, could you tell me again, where are you?
In Yerevan, in Armenia.
In Armenia. Wonderful. Thank you.
Yeah.
Autism is a very complex spectrum of disorders, and there are likely to be multiple manifestations that underlie various individuals as they experience their manifestation of this disorder. Now, there was a lot of early excitement about the possibility of a dysfunctional or perhaps disordered mirror neuron system in the brains of individuals with a kind of more severe form of autism. There is some reason to still think that that might be the case, but you are correct. It is a controversial suggestion, and there is quite a lot of debate in the field at present as to how much merit there is to that argument. My reading of the most recent evidence on this question is that there may be differences in the architecture of associational connections within the brain that explains, or at least produces, some of the phenomena that we associate with autism. It's interesting that you asked this question because I am teaching on this very topic tomorrow morning in my class on campus in the School of Medicine here at Duke University. And one of the perspectives that we're going to talk about is how, with modern brain imaging, particularly assessments of functional connectivity, there is quite a large diversity of functional connectivity patterns seen in adults with relatively high functioning levels of autism spectrum disorder. So a question is, how do those different expressions of functional connectivity arise in the lifespan? And that we don't know. There has been some notion that the young autistic brain is overconnected and the older autistic brain is underconnected, but those are just gross simplifications. I think what seems to be the case is that there could very well be some difference in the capacity for synaptic potentiation and synaptic depression that might ultimately lead to the growth and pruning of connections. And with some difference in the capacity for synaptic plasticity and the formation and pruning of neural connections, one might see the elaboration of different architectures, particularly across that associational network. So, for example, one fairly common experience of individuals with severe autism is a keen sense of proprioception. That is, there's an awareness of the body, but that body tends to be in a different form or a different state than what so-called neurotypical people experience. So, for example, an autistic individual might undergo some kind of behavior such as shaking of the hands or flapping of the arms, almost as a way to increase those proprioceptive signals because they're being integrated in a different sort of way. So those behaviors may arise because there's some kind of altered network of connections involving the body's image generated in the parietal lobe. And then there may be different ways of integrating the sensory world, more posterior regions of the brain, and as they're related to the frontal cortex. So we're beginning to appreciate really how diverse are the wirings of the brain, and they may ultimately reflect a difference at the level of synaptic plasticity, which is what triggers the growth or retraction of connections in the first place. So there's certainly a lot of new information that's coming forward. I think the mirror neuron hypothesis remains a hypothesis, and we need to understand more how important is that possibility within this broader spectrum of diverse cortical wirings. So, Artem, do you have any insights from your perspective on this question?
Well, I think I overall think in similar direction, and I believe that it is really connected to also the question what really makes us human, and I agree that it is probably the quality and extremely tiny regulation of these contacts, of these associations, of these connections between neurons that make us more intelligent. And really interesting issue is that really we have sometimes much more neurons in autistic patients, with many studies showing the same, but the response is much poorer. So that it's all about probably regulation of this growth. And another approach that I'm thinking about is that its association with tumor suppressor genes. And it's, again, a bit controversial in terms that sometimes some mutation to these tumor suppressor genes leads to, as a symptom, to autism, and their interrelation between growth of a neuron, its suppression, and its relation to dendrite outgrowth, for example. All these issues are involved. So thank you very much for your response, and I'm really enjoying the course. Not the first time I joined you, but this is first opportunity to talk to you in person. So thank you very, very much to you and your team. All the best.
You're welcome. Thanks so much for joining us. And I do appreciate your comments just now. I think that one of the interesting discoveries in neuroscience is how immune molecules seem to have an interaction with developing circuits in the brain, and that might be some kind of a link between the tumor necrosis factor family and circuit development in the brain, but it's something we have to investigate further. But I can't help but to think of other aspects of autism spectrum disorder that might relate to some of these topics, such as the common experience of individuals with severe autism, of how, for many of them, the world is so rich in detail, so much detail that for many of us that are so-called neurotypical, we either don't process that detail or we simply combine it and immediately abstract the larger whole, whereas someone with autism may be focused on more elementary features like color or shape or pattern. And so that suggests that, again, something about the associational networks where information is brought together might just be different in the brains of some individuals. And it's a quite interesting and, again, a controversial topic to consider whether the autism spectrum disorders is really a pathology or is it simply a difference. And that's a debate that's unfolding worldwide. And so I look forward to following that and hopefully seeing some contributions from you, Artem, and your team. So thank you again for joining us. Maybe we should go to Onur. Onur, I apologize if I'm not saying your name correctly, but go ahead if you are there. Hello, I see you, but I cannot hear you. I don't think you're muted, but go ahead and try to say something.
Can you hear me now?
Yes, I can. Go right ahead. Thank you for joining us.
Hello, Dr. White and other participants. First, I want to thank you for your work on course. It was very exciting and useful for me. So I did realize a lot of mistakes I did in my first medical school years. Now I'm on the fourth course, and your knowledge give me a lot of insight. So I think you are very good as educator, and I want to ask you a question about your life. I saw running, I saw guitar, and I am interested in, do you know some tricks we should use in our everyday life to be very successful, especially from neurological perspective?
Thanks for the question, Onur, and thank you for the nice compliments. I would say that there are principles of plasticity that we're starting to discover and beginning to learn how to put them into practice in everyday life. I wouldn't call them tricks, I would simply call them principles. So one principle is repetition. So very few of us have the patience to actually repeat a, let's say, skill that we might express with our hands, let's say in musical performance, with sufficient repetition to truly improve, to truly harness the plastic potential of the circuitries that are governing that performance. You may have heard about the 10,000 hour rule. I think that is consistent with this principle of repetition, that if you repeat a particular skill for 10,000 hours, you will master it and become an expert. 10,000-hour rule. I think that is true. However, there's more to consider besides repetition. One should work to reduce the variance from trial to trial so that you truly are repeating the same skill over and over again. Now, you mentioned my attempts at guitar playing, and I have a very patient music teacher who often focuses my attention just on one measure of music at a time. And he will encourage me to just repeat that measure 10, 20, 30 times until I memorize it and I can play it flawlessly. That's the kind of patience that I often do not exercise. But again, it's very important that one controls the variance. Otherwise, you are never really repeating the same thing twice if the variance of the skill is too large. And I think the same thing applies to the mental domain as well, or to any other discipline that one is acquiring through experience-dependent plasticity. And so how this relates to the nervous system is that as we repeat, we are reinforcing plasticity, be it long-term depression or long-term potentiation. And with that ongoing repetition is the opportunity to refine and to reinforce the appropriate circuits. And that does take time. And there's also other principles that I won't have time to elaborate here, but for example, sleep is a very important real-life principle that facilitates learning. We know that there is a kind of consolidation of learning that seems to happen when we sleep. So having the right balance between performance and practice and rest and sleep is going to be very important. It may be, for example, that we'll learn that the best time to practice a musical instrument is before bedtime, and then follow that practice with a period of sleep. You know, so I think there will be real life, real world applications. We just don't know enough yet to fully translate this basic discovery from neuroscience into everyday life. But I'm very optimistic about the future. I do think we will learn much more about all of this very soon.
Okay, thank you.
You're welcome. Should we go to Raphael next?
Jeff is next. Jeff.
Hi there, can you listen me?
Yes, I can hear you, Raphael. Go ahead.
Yeah, good afternoon. My name is Rafael Dantas. I'm from Brazil, and I'm sorry to be late. I was having class, so I'm a medical student here. I have a doubt. I'm from academic league. I don't know if this is neuroscience league, and I was following a neurosurgeon today, and I saw a kid, a baby, and he had a lot of cysts in the ventricle, and they grow up. So he developed good skills in speak and move the members. But when I saw the AME, I saw that was something very, how can I say, hard to do it. You know, it was difficult. And about plasticity, he never did it before, but just because he was exposed to stimulations, he could do it just about using this. And how could this be, how can I say, possible when you have a big damage?
So was this an acquired injury or a congenital injury?
Acquired. Was after he born, was hydrocephaly.
Ah, okay. And at what age is this patient now?
Before he does the, I don't know the English speak for this, but it's like a deviation of the liquid from the head to the abdomen. Yes. And he did it 3 days before he born, but still they had some injuries.
Okay, and how old is the child now?
He's like 2 years.
Hmm. Well, I certainly have learned to never underestimate the power of neuroplasticity, particularly of the very young brain. So I'm afraid I don't have any specific insight for you except to just note that the young brain is particularly resilient. And sometimes the earlier the insults happen, the more redistribution of function can occur in the developing brain. So I think if this hydrocephalus would have set in sometime in the first decade of life, maybe around the age of 4 or 5, the outcomes might not be so good. But I certainly hope there continues to be good outcomes. There are limits to the resilience of the brain. There are limits to the power of plasticity, of course. But I certainly have heard stories of the kind that you have just told us that makes me feel like there is always hope to improve the quality of life. The challenge is to understand how to actually do it for that particular child with that child's family in their context. So I'm sorry I don't have more specific information for you, but thank you for joining us in this Hangout, and thank you for your participation in the course, Raphael.
When you have a
Okay, let's go next to Ajit. You've been waiting very patiently for us. Thank you so much for your patience, and thank you for joining us. Go right ahead.
Hi, can you hear me?
Yes, very well. How are you?
I'm fine, how are you?
Fine.
My name is Gory. I'm actually using my dad's Google Hangout today.
Ah, okay.
I'm 11 years old, and ever since I was 9, I've been very interested in learning about neural studies. So I decided to do a course, and right now I'm on week 6.
Uh-huh.
And I have a prescription of -5, and I can't see very well. I was just wondering how, like, the lateral geniculate nucleus has to do with being nearsighted or farsighted. What does it exactly have to do with that?
Well, Gloria, you are a brave and courageous learner of medical neuroscience. Thank you so much for participating with us, being part of our global community. You realize that you are learning together with doctors and scientists and laypersons who are curious about the brain from all over the world. So thank you for your participation. To get to your question, the lateral geniculate nucleus is receiving inputs from the retina, and those inputs are going to be influenced by the optics of the eye that are producing the image on the retina. So if the optics of the eye are not well corrected to produce a sharp image, then we might imagine that the signals that are being sent to the lateral geniculate nucleus might be a little bit blurred in terms of their precision, both in space and in time. And so there's nothing impaired at all about the generation of signals in the retina and their transfer to the lateral geniculate nucleus, but the information that those signals convey is going to be less than if they were driven and stimulated by a sharp image formed on the retina. So I hope you have some correction that is available to you. Do you wear glasses typically when you work?
I wear contacts.
Contacts. Okay. Yes. Now this is a very interesting issue because what we've learned in neuroscience over the last 30 or 40 years is that the cortex, particularly the visual cortex, is very sensitive to the quality of the information that it's receiving. Essentially, the brain will tune itself for the quality of the information that it's receiving. So if the brain is constantly being exposed to a relatively low quality of information, it's going to be very well tuned to process low quality signals and have some limited capacity, therefore, to process the full range of information that's available to our sensory systems if and when it's restored. This is a particular concern with the young brain. So you're at age 11, you're becoming an older person now, and your brain is already beginning to pass out of some of those very early critical periods. The wiring of your visual cortex, for example, is very much adult-like, even at this young age. That's not to say there's still not capacity to grow and to form new connections and to learn. Of course, that will continue throughout life, but the basic circuits that are needed for sensory perception are in place even now, and much less susceptible to, as we say, low vision than they were, let's say, 4 or 5 years ago in your life. So thank you for the question. Is there any other comment that you might have or any follow-on question?
I say that you're doing a very good job teaching this course, and I'm a lot of fun. Thank you.
Well, thank you, Gloria. That means a lot coming from you. I do believe you might very well be the youngest student in medical neuroscience that I'm aware of. Certainly the youngest who's joined us on one of these Hangouts. So again, I wish you happy learning, and I hope that you can continue to develop your ambitions and aspirations for new learning and new knowledge, especially in the field of neuroscience.
Thank you.
You're welcome. Okay, let's check in with our friend Ellen, who is known to many of you as one of our lead mentors, and you've probably received many messages of help and encouragement from her. So, Ellen, why don't you jump on in here?
I always think it's a wonderful. Can you hear me?
Yes.
Okay, I always think it's a wonderful experience, these Hangouts, to hear all those very good questions. We see it on the forum as well. People are really asking deep questions, and you can see a lot of learning going on. So that's what I really like. I also want to encourage everybody to go into the threads, like Let's Discuss and clinical cases, and start reacting on each other. Not only give your own opinion, but go in that thread and learn from each other and strengthen each other in their learning. I think that's a very good tip you could take away at the moment, because it is not happening as much as could be done at the moment, but I'm really enjoying the atmosphere and like the thread with visualize your knowledge. There's some wonderful pieces of creativity there.
Yes, thank you very much, Ellen. I'm going to ask Nick, who should we go to next?
Madhu was in, and then Sadiq.
Okay. Madhu, go ahead and join us. You are currently muted, however. Please unmute yourself.
Okay. Are you able to hear me now?
Yes, I can. Thank you.
Okay. So I'm Madhu, and first of all, I have to thank you. I think you're a cool professor. I mean, you are, I think it's just been such a wonderful experience, learning experience. I wish I had more time to spend, but then, yeah, but anyways, I work with girls who've been rescued from human trafficking, so the victims of trauma, not as in traumatic accidents and things like that, but as in psychological trauma,
Yes.
And you did touch a little bit about neuroplasticity and how the brain can learn to do things differently. But I was just wondering, because some of these girls are like as young as like 14 and 15 years old and 16 years old, and the trauma, that because it's like complex trauma, so it has left such an impact on them, and it re-traumatizes them even after counseling and all that. So do you see like hope in the long run? I'm also doing like movement therapy and art-based therapeutic things, which I've just started, so that it can help these children. So what do you think in your experience and in your field of work?
Well, first of all, Madhu, thank you so much for the work that you do. It's as important as any work that any of us could possibly do. So thank you for the good that you're doing for the girls and the young women that you're helping. What I think about when you tell me about this kind of post-traumatic stress is the amygdala and the influence of the amygdala on neural networks throughout the brain. And that's a very, very powerful part of the brain that can have a profound impact on memory, on cognition, on behaviors of all sorts. So I think one strategy we might have is to gain access to that part of the brain and to see what can we do to try to recalibrate its output. And it's very, very difficult. There are strategies that are being used to try to extinguish the triggering experiences, be they memories or sights or sounds. There may be some hope in that, essentially trying to promote what we might imagine would be something like a long-term depression for the inciting associations, and perhaps long-term potentiation that would favor more normal types of associations. I love the idea of a multimodal approach, however, so thinking about using art, using other kinds of social relations as a way to try to moderate the power of that vigilance that has been wired into the amygdala as a result of that trauma. So, you know, there are lots of approaches. Certainly there is a pharmacological approach that seems to help some individuals, but I think we need to get beyond the pharmacology and try to normalize the function of this very important part of the brain that helps to mediate social behaviors in our response to what appears to be the potential of threat in social relations. So I don't have the prescription for how to best do that, but I do think about the role of the amygdala in building that association, and then its influence, which is to increase the response of so much of the rest of the brain in sort of a self-preservation mode of behavior, and that's often what leads to the state of heightened anxiety and various other kinds of counterproductive, inappropriate types of responses to everyday life that's part of that post-traumatic behavior. Okay, well, thank you very much. And let's go on to Sadek. Are you there, Sadek?
Hi.
Hello.
Hello. Sorry, it's my first time here in your course, and I really appreciate your all your efforts. What are you doing is very interesting. Actually, I'm in my residency in neurology in Algeria, and I really do appreciate, even if I have already been in studying those basic things, but I enjoy every time restudy and require new information and new, even if it's basic level. And I think that, like you say, neuroscience, every time we find something new, it's the word of the Nobel Prizes, like you know, as all of the frequent and the most Nobel prizes right now are about neuroscience. So it's very interesting to work in that kind of job. So thank you.
Well, thank you very much. That's nice of you to say, and I appreciate your interest in the course and your participation with all of us.
Thank you.
Do you have a particular question about the field of neuroscience or your interest in it?
No, not yet. Right now I don't have any question. I just share this Hangout with you.
Okay, well, thank you so much. Thanks for joining us. Best wishes to you.
Elgin? Elgin?
Elgin, are you there, Elgin?
sorry. Yes, I am. Good afternoon or good morning. I don't know. I'm talking to you from Brazil, and it's my first time here on a Hangout, so I'm quite lost, I must say. I just love your course, Dr. White. I think it's just an opportunity that shouldn't be missed. I have come to week 4 now, and you have been talking there about the plasticity questions, and I've come to the point where you mentioned that the application of a kind of tetanus stimulus would be able to have sometimes lifetime enduring effects. And now I wonder, of course, can we provoke such stimuli purposefully or whenever we want to, and how would this be done?
Thank you for your participation, Alvin, and for your question. So there may be various ways in which the equivalent of a tetanus is created within our own nervous system. Obviously, the tetanus itself is a very artificial stimulus that is created in the experimental situation to measure long-term potentiation when it's evoked at its maximum capacity. But we know that's really not how the brain works. So there must be a more natural way to evoke a lifelong change in synaptic connectivity. And that's where we get back to what I was talking about a few moments ago with another guest in the Hangout about principles of repetition and specificity. So specificity is a way of focusing on a particular act. Perhaps it's a motor act, or perhaps it's a thought, something that you would be able to rehearse, but to do so in a highly specific way so that you really are repeating or rehearsing the same act over and over again with minimal variation. So having specificity with repetition very well may put you in that regime that favors potentiation. And what we know now on a spike-specific level is that if we favor a presynaptic input firing a postsynaptic neuron within a relatively short interval, that will favor potentiation. That's the spike timing dependent plasticity rule that favors potentiation with presynaptic firing postsynaptic. Now, if we add to that repetition, and we're in a position to continue to drive that same circuit in the same way with that very short interval pre, before, post, then we can reinforce the connection and promote the elaboration of parallel collaterals that will strengthen that network. So the challenge to apply these things to real life is to, I think, really minimize the variation in our repetition, and then to exercise that repetition beyond our usual limits of patience and endurance that so often derails those of us that are trying to learn a new language or learn a new motor skill or pick up a new sport or play a new instrument, something of that nature. Now, the other factor is actually what we were just talking about with our previous guest, and that is the role of emotion. So emotion has a way of increasing the intensity of the signaling that's happening at a distant circuit. So I think there might be a way to use emotion in a constructive way here. Obviously not such intense emotion that it can lead to a kind of post-traumatic type of state of brain networks, but rather to facilitate the emotion. I mean, we all have the common experience of trying to think back to our childhood and recall our earliest memories. Isn't that a remarkable feat for someone like myself that can go back nearly 50 years and recall an event from early life? Now, something happened 50 years ago that altered the connections in my brain, and some of that alteration persists today. Now, what we know is every time we remember something, we can potentially change it, and I probably have changed some of those early childhood memories in ways that I don't even know. But the fact that they're still with me suggests that this sort of plasticity can indeed be lifelong, at least as the integrity of those circuitries remain. So thank you for the question. Again, I wish I could do a better job translating some of these basic principles of plasticity into everyday life. But if you bear with me and with our broader community of neuroscientists, I am hopeful for the future that within just a few years we'll see more and more discovery that will begin to impact society by applying these principles of plasticity. So we are just about out of time. I do have a meeting to go to, so I apologize for cutting us off as sharply as I must today. But thank you all for your participation in this Hangout. It's always a great delight to get to interact with you in real time and to see many of your faces. For those of you who've been following us online or who may watch this later time, I thank you too for your interest and your attention. Otherwise, I just hope that we all continue and support each other in our learning in medical neuroscience. And I look forward to the next time we have a chance to do a Hangout such as this. So thank you all for joining us, and best wishes to you all.
Thank you, Dr. White. That was